Dignity Health Medical Group has a mission to make sure people are living their healthiest lives. One area that is helping people, and that is the Orthopedic Oncology Department. And here to help us understand orthopedic oncology is Dr. Ram Kumar. How are you, doctor?
Good morning. Thank you very much for having me.
So, you hear this a lot, hey, you need to see an orthopedic oncologist, or we see the name on the wall. Sometimes we walk through the hospital. What is it that we're actually seeing the doctor for?
Yeah, that's a good question. So orthopedic oncology is a subspecialty within orthopedic surgery, and we basically specialize in the treatment of bone and soft tissue tumors that affect the musculoskeletal system.
All right, so with that, you just said something about tumors.
Yes.
So this is kind of like where you really go into the bones and to see what's going on?
Right, exactly. So there are a certain group of cancers that can originate in the bone or in the soft tissues like the muscles and tendons, and those tumors are generically called sarcomas. They're malignant and very rare. So that's one type of patient population that we see. And then there's a whole other subset of patients that have cancer that perhaps originated, say, in the breast or in the lung, the kidneys, etc., that can ultimately spread to the bone. The bone is one of the most common sites of distant spread of carcinomas. And so we tend to see those patients as well.
Yeah. All right, so when should someone see a orthopedic oncologist?
Typically, they end up getting referred to us when they have either an incidental finding of a soft tissue tumor or a bone lesion, or perhaps they're already under the care of an oncologist and they ultimately have been diagnosed with disease that has spread to their bones and they need evaluation of their skeletal system. So oftentimes patients have pain, they may have a new soft tissue mass, they may have incidental findings like numbness or tingling or nerve compression that ultimately needs to be worked up and may be attributable to a tumor.
Yeah, okay, so after finding these tumors, what's the next process for people?
Generally, most of these people need some form of a biopsy to essentially prove what type of cancer that they have. And once they've had that biopsy and a diagnosis has been made, in the case of sarcomas, for instance, we actually have a multidisciplinary team of oncologists and radiation oncologists and pathologists. We all meet together and we help develop a care plan. And that oftentimes entails some form of surgical treatment in conjunction with radiation and or chemotherapy or systemic therapy.
Yeah, I'd say Dignity Health Medical Group is very happy to have you because you are very well known in this field, even to the where you are teaching people, you're helping them understand more. Tell me a little about that.
Yeah, absolutely. So we actually have a very, very small subspecialty. There's about 200 of us in the world that practice full-time orthopedic oncology, so it's a very small community. And we take care of these rare orphan diseases that, unfortunately, many other larger industries don't necessarily focus on. And as a result, most of us feel that it's part of our mission to help educate not only the next generation, but our peers and our patients to ensure that they have optimal outcomes for these diseases.
Yeah, let's talk about some of the technology that you're starting to use now because, as you said, it's a very rare group here.
Yeah.
And you really have to rely upon some of the technology that you're actually creating with this group so you can help people.
That's right. That's right. Yeah, so some of the technologies that we're using for treatment include 3D printing implants. So a lot of these patients, once they have resections done, there are large parts of their skeletal system that is missing that we now have to reconstruct in order to kind of restore function to their extremities and allow them to live a relatively normal life. So we have partnered with 3D printing companies that basically print metal implants that are customized to the patient for their specific resection defect. So it's a very individualized treatment approach. The other thing that we're doing is we're tissue banking all of our tumors, and we genetically analyze all of our tumors. And so this allows us to pinpoint with kind of a precision approach exactly what abnormalities that might be present in that patient's tumor and help target that with treatment rather than taking a more generalized approach and essentially using cytotoxic chemotherapy to completely kill the tumor.
Yeah, I like what you said right there is that you do individual, and that's something that people need to understand that it's different people, different ways, and that's why you do need to see someone like you to help them be able to live the best life they can.
That is exactly right. I think at the end of the day, the treatment paradigm is shifting a lot in oncology, and it's great to be part of that paradigm shift. And we're moving more and more towards precision oncology. And that's something that we really are proud of and are able to offer.
Yeah, wow, this is amazing. Doctor, I'm so glad you came in to explain a little bit to us about this. This is great. So
thank you very much.
Thank you.
Thanks for having us.
So if you want more information on Dignity Health Medical Group, there's information around the screen, or you can head over to the cw7az.com.
The preceding portion of the Arizona Daily Mix was sponsored by Dignity Health.